What is today's topic about? One of the proven benefits of healthy diet is a reduced risk of depression and a 40% improvement in your thinking. Several studies have found that eating a Mediterranean diet actually reduces depression symptoms. More Australian studies are showing the same. Even though there are only 2 studies, we are still a ways off from declaring this an official protocol, but even with just what we have currently, the results are adequate to recommend this as a treatment for depression. The study consisted of taking 2 groups of people suffering from depression and giving them social support counseling sessions, and dietary counseling sessions with a dietitian. Counseling for mindfulness included teaching mindful eating. Social support groups did not involve supportive psychotherapy, but activities such as playing cards, talking about sports, and reading. As measured by depression scales, the diet group showed significant improvement in their depression symptoms after 12 weeks. Talking about sports or books is not therapy. In research, scales are tools used to gauge the severity of illnesses and quantify them. The eating plan is especially worth looking at because, as well as preventing depression, it can also influence a person's current depression. MediMod is a modified Mediterranean diet where no calories are counted or points are kept. Consume brain-healthy foods such as whole grains, fruits, vegetables, beans, fish, and extra virgin olive oil. After that, they reduced or eliminated foods that are bad for the brain, such as refined cereals, fried and sugary foods, and processed foods, such as white bread. What are processed foods? These include things like deli meats, crackers, cookies, and chips. You want to consume food as true to its original state as possible. The diet still works if you cannot tolerate gluten. The diet is still a good diet if you avoid grains containing gluten. These grains include wheat, rye, and barley. Buckwheat, oats, and millet are gluten-free whole grains. Whole wheat is the most common grain, but variety is important. Brown and black rice are both whole grain options. Couscous and quinoa are also whole grains. For pasta and bread, look for 100% whole wheat or whole grain. Why is this so effective? We know inflammation causes depression. Nutritional supplements, such as B vitamins and folate, can reduce depression, as they aid in neuroplasticity. Healthy diets are anti-inflammatory and rich in nutrients that promote brain health. In essence, neuroplasticity is a result of the connections within the neurons. Tight connections help the nerves communicate with each other. The nerves have a hard time relaying information between their cells when the connections are loose. Loose connections between nerve cells affect their ability to relay information. A healthy diet, for example, increases levels of brain-derived neurotropic factors. Antidepressants have a similar effect. This is how diet affects you in both a positive and negative way. Can it work in a short time? Because the patients in these studies were not retested for 3 months, we can't tell whether they became better sooner than that. Nevertheless, another study using the Mediterranean diet shows that your gut microbiome can change over a 2 to 3 week period. A person's gut bacteria is crucial to his or her health, and his or her health influences the health of the body as a whole, including the brain. However, we do not know how quickly an improvement in gut bacteria ripples through to improved mental health. Mediterranean diets reduce the risk of stroke and heart attacks even if you do not have depression. If you have kidney disease or lactose intolerance, you might need to adjust the diet to fit your special needs. The thing I like best about this diet that works regardless of how you choose to modify it is the reduction in processed foods and sugar. Whole foods make a difference regardless of whether you're eating paleo or keto. See you next